Hello, hello, hello. I'm back. People may think we're just making small talk, but part of the reason why I ask you that is because this is a great time to go out and explore. And I'm sure you'll explain that some more as to how that helps people as we go through social distancing and dealing with being mindful during this time. And that kind of brings me to my next question, which is tell us a little bit more about what you do. First it says you're board certified internist, meaning you're a physician, but medical acupuncturist, yoga teacher, mindfulness practitioner is a pretty big extra set of work, I would imagine. So what got you into this and how do you apply it day to day?
Yeah, that's a great question. I spent about 10 years of my career treating patients with severe illness, both managing them in the hospital, so people in ICUs and people who are really critically ill. That's the core of internal medicine. I then from that went on a path to do palliative care and a little bit of hospice as well. So at one point, over the last couple of years, I thought, I think it's really what is the next stage of my career going to look like? What do I want to kind of do to leave my stamp on things? And yoga and acupuncture are two things that for me really helped me through anxiety, depression, and the stress really that we all encounter in our day-to-day work. So I thought, well, why not see if I can put the two of these together? And that's where the idea of mindful medicine came, is let's try to bring things back to being a bit holistic. Let's look at what is the root of the problem that we're experiencing instead of covering up a blood pressure with medication, right? Like, how about if we talk about diet and exercise, and let's just bring a little bit of mindfulness to what we're doing. And I think, Cindy, you and I can both agree that this isn't about the physicians, about our colleagues not doing a good job. It's a system problem.
Yes.
And the way that our system is set up for 10 or 15-minute visits, if we're lucky, seeing 20 or 30 patients a day, and then spending a few hours at night documenting, there's just really not a lot of time in the system built in for us to spend the time with patients that we want to spend.
It's true. And I think most patients aren't aware of that, which is doctors are now put on so many time constraints that we many times want to ask about the emotional questions, the day-to-day activities, and how is life affecting your health, but we don't really have that time. And so I'm glad that you decided, I want to put all of this together. So how did you go about getting certified and really putting together a program?
Yeah, great question. So I, as I mentioned, I was a bit familiar with acupuncture because that's something that I received myself, and it really helped me to deal with anxiety. One of the other things about my job was in palliative care. I spent a lot of my time writing opioids. And so with this whole opioid epidemic, I thought I want to be a little bit more responsible about what I'm doing.
Yes.
And is there a way that I can treat and manage pain without just piling on the medications?
Yes.
So I, to keep it simple, I enrolled in an acupuncture training program for physicians. You wouldn't believe how many physicians I met during that training that would say, this is what's really going to save my career. This is going to allow me to spend more time with my patients. This is going to allow me to treat conditions by getting to the holistic, nature of the person instead of another prescription.
Yes.
So it really just happened kind of organically and naturally. And at one point I had to just say, look, I'm going to quit my job. I'm going to open this practice and kind of put it out to the universe that this is what I have to offer.
Mm-hmm. And I think what you've done has been terrific. And I know you're seeing some amazing results with your patients, which is proof that this is necessary. And for those who are listening, because some people may not be familiar with the term palliative care, so they can really understand your background, in the context of being a hospice doctor and a palliative care doctor, what was your day-to-day like there? What were your patients like? What was happening in that setting?
Yeah, so most of my patients that I would meet would be really sick with many chronic conditions, patients with cancer, patients with chronic obstructive lung disease or emphysema, patients with an end-stage neurologic disease like Lou Gehrig's disease, for example, patients who really have limited options. But with palliative care, these are people who want to focus on living as good as they can for as long as possible, right? And they want to minimize interventions that may not help them improve, that may not really improve their quality of life.
Yes.
But unfortunately, a lot of what we have to offer is symptom relief. Is limited to symptom relief, right? So the focus for folks on palliative care may still be curative. Folks may still be getting chemotherapy. They may still be getting disease-directed therapy like dialysis, but for the most part, the focus is going to be on symptom management.
Yes. The symptom management to make them as comfortable as possible, really. And so that can take a toll not just on patients, but on the doctor, because sometimes you lose sight of the human involved if you're treating.
Yeah, absolutely. Well, I think what ends up happening is, despite our best efforts and as much as we really want to have time with our patients and have time to talk about family and what's important to them, it's on to the next, and it just kind of perpetuates this unfortunate cycle. So what I think palliative care offers that some of the other specialties don't is time. I mean, we would spend an hour and a half with patients and their families. We were really blessed with the time that we needed to have